Hello to everyone attending the third EBR Conference. I'm Ishanka Weerasekara, an Applied Research Fellow from Melbourne, Australia, presenting this on behalf of my team. Professor M.D. Lamavansa, Vice Chancellor of University of Peradeniya, Sri Lanka. Professor Declan Devan, Director of Cochrane Ireland and Cochrane Evidence Synthesis. And Professor Hans Lund, Chair of Evidence-Based Research Network, Norway. This presentation discusses the initial steps and plans to improve the recognition of systematic review and evidence-based research in Sri Lankan universities. It has been reported that 85% of health research was avoidably wasted, which costs annually $170 billion globally. There were a number of reasons listed: poor designing of the new studies, inadequate replication of the initial findings, deficient attempts to obtain and use the existing evidence, and biased underreporting of studies with negative results are some of them. We as health researchers are responsible in minimizing this research waste. One of the ways doing this is to justify planned research based on an evaluation of the existing evidence on the interested research question. This can be achieved by identifying any existing systematic reviews, or if it doesn't exist, by conducting a new systematic review. Evidence-based research approach highlights systematic and transparent use of prior research to inform a new study to answer questions that matter, valid, efficient, and accessible. In particularly, the EBR approach promotes two specific things. The first one is well-defined research question addressing the real research gaps as identified by the current evidence. The second thing is forming research questions which answer the needs of the end users, simply who are affected by research or who uses the research findings. There are a number of barriers that prevent implementing the EBR approach and similarly conducting systematic reviews in Sri Lanka. The lack of academic recognition of systematic reviews was one of the reasons that can be a barrier. For an example, it is rare to see academics encourage their higher degree students to do a systematic review prior to set the research objectives of their projects. Another barrier is the lack of methodological expertise to conduct or to lead a systematic review, and also, unfortunately, lack of access to electronic databases and paywall against access to the full text papers also make it difficult to conduct systematic reviews or to follow the EBR approach in Sri Lanka. Having those barriers back on our mind, we wanted to find potential ways to promote systematic reviews and EBR approach there. Therefore, we aim to discuss the strategies to promote and support the use of systematic reviews and EBR approach among the university academic staff and postgraduate students in Sri Lanka. For this revolutionary change in promoting EBR in Sri Lanka, we selected the University of Peradeniya, one of the two best public universities there, in which 12,000 undergraduates and 4,000 postgraduate students are enrolled. Promoting and supporting the use of systematic reviews would help the academic staff and students' capacity to plan, design, conduct and analyze, and also report systematic reviews that answers valid, efficient, and accessible research questions. As the first step to improve the recognition of systematic reviews, evidence synthesis, and the EBR approach, we brought a letter to the editor to the university journal. We have discussed the need, importance, and suggested a range of specific activities to achieve our aim. The suggested activities included conduct lectures and launch talks on importance of systematic reviews, training on systematic review methodology, including train the trainer programs, organizing annual workshops on systematic review methodology for academic staff members, research supervisors, and higher degree students. Then obtaining access to the electronic databases and required software, organizing annual seminars for academic staff and supervisors on the importance of systematic reviews in research projects, including the higher degree programs, training librarians on database search and on building systematic search strategies, and this continuous to training of statisticians to support meta-analysis and meta-regression, promoting systematic reviews as dissertation projects, like the chapters within PhDs, and undergraduate and postgraduate level training through workshops and seminars, and then encouraging conduct of systematic reviews in high degrees, establishing an EBR National Center or National Center for Synthesis of Evidence, or maybe Cochrane affiliation at University of Peradeniya, which will ultimately promote the participation in international training and fellowships and making international collaborations through these established centers. Well, to make the EBR approach a reality, the coordination between the faculty education units, higher degree committees, faculty libraries, higher degree advisory and faculty boards, head of the departments, deans, the vice chancellor, and the systematic reviews and national centers of evidence synthesis around the globe is required. While some practicalities such as database access and software access remain challenging, this proposal, we believe that can be supported by internal and external resource personnel. For an example, international EBR network, Cochrane teams such as Cochrane Ireland or Evidence Synthesis Ireland. The coordination through an international advisory group would assist in identifying the potential barriers, challenges, and funding to move forward and make the program sustainable. So far, we have achieved some targets. Our letter to the editor, which stressed the importance and the strategies, is now published online. There are 9 faculties in University of Peradeniya, and all the faculties have access to this journal. We have identified the International Research Center of University of Peradeniya as the coordinating body to implement the identified strategies. A basic introductory systematic review course is planned to open to all the health and non-health faculties of the University of Peradeniya, Sri Lanka in 2023. Individual researchers and research groups of the university will be invited to these courses. Also, an advanced systematic review course is planned to implement for the interested academics and postgraduate students upon the completion of basic introductory course in 2023. At the end of the course, the participants are expected to produce a publishable systematic review protocol. In addition, several informal small group systematic review trainings were conducted. Several honor students projects were completed as systematic reviews. Number of postgraduate projects have included systematic reviews prior to their project designing. We hope the benefits of the academic recognition of systematic reviews, evidence synthesis, and the EBR approach include potential solutions to many obstacles in Sri Lanka in achieving excellence in scientific research and publications. For an example, more relevant and needed research will be conducted using systematic reviews to justify and design new studies. The scarcity of high quality systematic reviews submitted and published by the University of Peradeniya and Sri Lankan University academics can be better managed by this approach. It will also help the academic and research staff to develop their scientific writing skills, improve their methodological expertise, and increase their networking capacity and collaborations. In conclusion, some specific approaches were identified and initial plans were implemented, aiming to improve the capacity building of the academic staff and postgraduate students with the ultimate goal of improving the recognition of systematic reviews and the EBR approach in Sri Lanka. Advancing these approaches into a sustainable program and establishing an EBR National Center are yet to be discussed. Any ideas and suggestions are welcome from this forum and also through the evidence synthesis bodies that you are affiliated to us to move forward and also to make our program sustainable.